A lot of the reason why healthcare is so expensive is because you have been separated from the decision making when it comes to healthcare services. And that didn't happen overnight. That happened gradually over time. And it isn't like a grocery store completely. It's not like the hardware store. If you have an emergency, you're not going to be, thumbing through the yellow pages, picking out your hospital while you're having a heart attack, trying to figure out which hospital to go to. But a lot of healthcare decisions are like that, and those are the ones that should still be in your hands. Well, anyway, little trip through history here. Let's talk about how the entire system got so big and bloated and kept separating you from your own personal healthcare decisions over time. So, prior to World War II, people just purchased their own healthcare. They were starting to purchase health insurance. There was Blue Cross, there was Blue Shield. They were not the same company at the same time, but they were insurance companies in case you had to go to the hospital or suffered a very large healthcare expense. Okay, then World War II happens, all right? Many individuals were overseas fighting in the war, and that meant that here in the States, there was a shortage of labor, and that meant that employers were paying more, higher wages to draw in new employees. Well, government saw this and thought it was a very, very large problem. So they decided to implement basically a maximum wage, and they're talking about a minimum wage now. This was like a maximum wage. There was a cap. It's like you cannot pay your employees any more than this. Your government did that. So, and it was to try and keep that all under control or whatever. So what did the employers do? Well, they didn't just quit trying to get the best talent or the best employees. They started to offer other things, such as healthcare benefits. That was the big one. So that became a commonplace practice, and that is how employers got stuck with paying for healthcare benefits for their employees as time's gone on. So, and it wasn't taxed. So since it wasn't really income, it was healthcare premiums, it wasn't taxed. Nobody said anything about it until 12 years later when the government decided, hey, let's just keep not taxing this. So now you have employers paying for health insurance and the added incentive of the tax benefit as well. So that was 1954. Moving on. 1965, that is when Medicare and Medicaid were introduced to the American public as part of the Social Security Restructuring Act or something like that. Anyway, that is when Medicare and Medicaid became a thing. And as usual, just like with the wage controls, the government had all the best intentions in mind. They wanted to take care of the elderly people and people who could not afford health care. So that was the idea. But just like with any great idea that the government comes up with, there are unintended consequences. And some of the unintended consequences were that you created a public option that was now competing with the private insurance market at the same time. So that was one thing. And then later on, around the early 80s, late 70s, that is when the ICD coding, ICD stands for International Categorization of Diseases, I think. But it's like 150,000 codes now that we use to categorize illnesses, all right? And they started using those codes in the early 80s to bill. So hospitals and practices would bill for that when it came to Medicare and Medicaid. It wasn't with private insurance at first, but obviously since Medicare and Medicaid are such huge entities, that kind of seeped in to the coding practices for private health insurance as well. So that is how all of us providers get the privilege of coding and billing using the ICD system. Once again, that is a skill that does not help the patient in any way whatsoever. It is all just about how you get reimbursed. It's like learning an entire new language. I mean, think about it. How many times have you been impressed with how well your doctor is able to code? I was actually really good at coding, but none of my patients cared. It was just the business office. So anyway, You can see it's getting bigger, more bloated, separating you from your healthcare decisions. Okay, moving along. Let's move right along to 2010 when the government decided, we really need to make healthcare more affordable, okay? So what they came up with at that time, and hey, look, their motivations were likely very good. Wanting to help people, wanting to lower the cost of healthcare, but the way they did it, despite their good intentions, just didn't pan out the way they wanted. So it was the Affordable Care Act, which makes me smile a little bit to say, but what the Affordable Care Act did was say, okay, first of all, insurance companies, you are not allowed to disclude people for pre-existing conditions. You have to include coverage for pre-existing conditions, okay? Good thing, right? But does make things more expensive. Individuals can stay on their parents' insurance policy until they're 26, okay? There's an individual mandate. Preventive services are required to be covered by insurance. So all of these little regulations that came in sound pretty good, but it definitely had the effect of raising healthcare costs. Premiums have been rapidly increasing since that time, and deductibles have been increasing too. And the number of bankruptcies due to healthcare expenses has not gone down, we'll say. So, as you can see, all the best of intentions doesn't necessarily translate to good results. The government getting involved in healthcare should make you a little bit leery if you're thinking about Medicare for all, for example, or one of those options, because right now, a lot of people just say that like it's a magic word. But if Medicare just came in and started paying for everything, they'd be paying for the exact same messed up system that we currently have. And it's already scheduled to go insolvent in just a few years. So something to think about. But anyway, now we're here. And as you can see, as the public health insurance and the private health insurance have gotten bigger, gotten their hands in more pies as time's gone on, costs have gone up and healthcare quality has gone down in recent years. Our life expectancies are shortening, and there doesn't seem to be any end in sight. So we need to do something new. Now that you know how we got here, pretty soon we're going to start talking about how to fix it.